Okay, hi Brian, it's Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything's magnified 30 or 40 times, hold that please, on the screen. And what we're looking at first here is your biceps tendon. This is it running up towards the top of the screen. Looks like a rope there. And one of the areas we were worried about was the anchor site. And although it's a little bit cracked, you have to remember with the magnification we're under, that's actually really small. That's not enough to need a repair, so that's encouraging. I do see a little bit of a, interesting, it almost looks like those two were connected at one point, a little tear here. We'll put in our shaver and smooth that out. See how we do that. Okay, we'll look down the front of the shoulder since we're here. And this anterior labrum looks perfect, no problems here. It's the middle glenohumeral ligament coming across. And that looks pretty good. Rotate, or hold the shaver. We're going to look here at the rotator cuff. And fortunately, this is good news, at least from this side. That looks great. Rotator cuff looks good. So far, all we've had to worry about is that little bit of a tear in the labrum right here. Okay, hold the shaver, please. We're going to rotate and look towards the back of the shoulder in just a minute. Pause, please. Okay, we're looking here towards the back of the shoulder, and the anatomy here looks great. No signs of any problems. Articular cartilage on the humeral head looks normal. The posterior joint capsule looks good. As does the posterior labrum and posterior aspect of the glenoid. So we'll keep looking here. Make one more kind of lap around the joint. If there's anything that we need to show you, we'll come back up on the video. But otherwise, I think the next thing we show you will be our work on any bone spurs up above. Pause, please. Okay, we're just above the rotator cuff now in a part of the shoulder called the subacromial space. We've got a burr here just smoothing out a little bit of this bone spur that I think was causing some of your symptoms. And making that nice and flat. Okay. Okay, so the shaver. And now we're going to have a look at the rotator cuff from this side and see if there's anything else we need to worry about. And we're going to start looking in the front. And this part of the cuff actually looks pretty good. We'll abduct quite a bit. And then we'll internally rotate. And this shows us the more posterior aspect of the cuff. Once again, what I'm shaving is kind of bursal tissue. The cuff itself looks good. I'm all the way back here. Okay, so I'm happy with the way that looks. I don't think you need anything done to the rotator cuff. I think we've gotten the bone spurs off and taken care of a little labral tear inside the joint. We're going to get you back to the recovery room shortly. Good luck to you now. Bye-bye.